Hi friends, Kaya Grossberg here, and I wanted to address one of the things that Susan Weed said on the podcast I went on with her last week, which was that she said that most people who are diagnosed with schizophrenia or bipolar are violent and unsafe to be around. And there are a lot of reasons why I want to address that, besides just the simple fact that I haven't found it to be true, and it hasn't been found to be true. It's more true that people who are diagnosed by psychiatry are likely to be victims of violence than perpetrators. And the reason for that is that most people who get a psychiatric diagnosis are the identified patient or the scapegoat in the family system or whatever system they're in, whatever social system they're in. And there are many people who are violent who do not get a psychiatric diagnosis. So yes, there are some people who are violent that get a psychiatric diagnosis, but it's often because they actually have less socioeconomic power than the other people in their family system or social system. Most of the people who are violent and don't get a psychiatric diagnosis are either very quote-unquote high-functioning abusive people who just wouldn't even go to a psychiatrist or a therapist even because they don't see themselves as having any kind of a problem, and they have enough socioeconomic power to abuse other people rather than dealing with their own problems, which is like extremely common archetype in family systems, in families, and in other social situations like workplaces or social groups. The abuse could be physical or emotional, but in terms of actual violence, there's a lot of actual violence that goes on from people who do not get psychiatric diagnoses. Now, if the violence becomes very, very extreme to the point of like killing people or things like that, then those people usually would end up in the criminal justice system most of the time if they are people that are unlikely to seek help from the mental health system. And that's where, in terms of violence, we get this sort of, there's this blurry zone, like what's quote unquote mental illness and what's criminal behavior, and where do we draw the line there, and how do you distinguish? But my purpose in talking to you today, the point that I'm trying to make here is that there is a disparity between those who have more socioeconomic power, more money, more control. For example, in a family with, parents and children, like parents are often violent towards children, and then they also often put their own children into the mental health system as identified patients and scapegoats who are then identified as mentally ill, so that the parent then doesn't have to deal with their own stuff and own their own violent behavior. So anyone who's violent towards a child or towards a helpless person or really towards anyone has an issue that needs to be dealt with. It's not to say that violence is fine from anyone to anyone else at all. But the people that I advocate for are those who are identified patients, those who have been victims of violence and then scapegoated. And oftentimes these people are holding very potent medicine, and it scares their family, and it scares the people who've abused them, who have controlled them, and who haven't been able to deal with their own stuff, and who haven't had to, because they've had the power of being able to unload their stuff onto this identified patient, who then gets a mental illness label and often gets put on psychiatric drugs that make it harder for them to be strong in their medicine and to have the power to either fight back or to just be a really strong person with a strong voice in the world. So that's what psychiatric drugs do. You know, they repress people's energy and their voice. And, you know, sometimes people appreciate that effect because it helps them to get through something. It helps to maybe numb out some pain. It helps to shut off some of that flow because it became too much or felt unsafe. And there are a lot of cases where people don't like that effect because it shuts off the flow of their power and their potency and their voice and their medicine and what they're here to do. Even without psychiatric drugs, a lot of people who are in a scapegoat position or considered to be very sensitive or who are identified patients in their family systems can have a really hard time owning their power and their voice and finding a place in society where they can utilize their gifts in a way that is both feeling safe and grounded and helpful for others and bringing them what they need in life. So my mission personally is to amplify those voices, and for anybody in that role, in that archetype, who doesn't want to be on psychiatric drugs, who wants to be able to give it a go, you know, to give it a try, to live out who they are. I mean, these are the most potent healers in our society. These are people that have codes and messages. These are artists. These are people that are so sensitive, they're picking up on things they don't even always know they're picking up on. And that's where it gets tricky, right? Because especially when they're young, when we're young, there is not always clarity about what's going on. A lot of times we do not even know what we're sensitive to, what we're picking up on, what is moving through us. And that at that time, for somebody that doesn't know how psychiatry works or where else to seek out support, it can be very common to get put on psychiatric drugs or to feel very overwhelmed and like a sense of emergency and needing help and needing support and needing somebody who can, you know, just like help somebody figure out what is going on here. So I wanted to put that message out there because this is a different archetype. This is an archetype of people who get labeled with mental illnesses, who get put on psychiatric drugs, and who are not violent. They're not violent people. If there are incidences where they are harming themselves or others, then those need to be addressed in different ways. But for people who are of the archetype that I'm describing, psychiatric medications can suppress their voice and their medicine, which is really heartbreaking for the world, like how many people this has happened to, because all of those people are then holding medicine that we don't get access to. And if you are that person, I'm sending you strength, clarity, and freedom. And just take a moment to breathe into that. If you're on psychiatric medications right now and you feel like you don't even have full access to your strength, clarity, and freedom, close your eyes. Just allow a moment to feel the hope, the possibility of what it would be to have that. I just want to keep saying it's always possible, and the biggest obstacle is fear. The biggest obstacle is fear. And the fear is totally understandable. You know, it is really scary to be living in a world that has this assault and this attack on people who are holding the highest frequencies, the most important energy and information. So I'm going to say a lot more about this topic, but this video is starting to get long, so I'm going to leave it there for now. Please like this video, subscribe to my YouTube channel, let me know what you think in the comments, and share this with anyone you think would benefit from it. Thank you.